The following segment will discuss the Browlift procedure.
Surgical rejuvenation of the brow, commonly known as a brow lift, is a frequently performed plastic surgery procedure useful and necessary for improvement of facial aging. Some of the most dramatic improvements we see from plastic surgery can be achieved with a properly performed brow lift on the appropriately selected patient. Although brow lifts may improve other areas, the main effect is to provide a more youthful and energetic appearance around the eyes. The preceding segment on facelifting also has excellent examples of brow lifting techniques. This is a before and after photograph of a sample patient who has had a brow lift. She also had surgery on her upper eyelids to remove some remaining excess skin. You can note the improved appearance around the eyes. The eyes appear more open, less tired, and certainly more youthful, without appearing surprised or unnatural. These are before and 3-month after photos of a 44-year-old patient who had a coronal brow lift, upper blepharoplasty, rhinoplasty, and facelift. The hooding above his eyes gave him more of an intense, tired, and sinister appearance. The brow lift was effective in lengthening his brow, decreasing the furrows, raising his hairline, and improving the hooding above his eyes. Together with the blepharoplasty, his eyes are much more visible and he looks younger and more approachable. These are before and 6-month after photos of a patient who benefited from a forehead incision brow lift and upper blepharoplasty. The incision at the hairline is healing well enough to not be noticeable. She had improvement in the furrows between her eyes, as well as looking more refreshed, alert, and not looking surprised. These are isolated before and 6-month after photos of a 49-year-old patient who had an endoscopic brow lift, upper and lower blepharoplasty, and facelift performed. Makeup in the after photos certainly adds to the improvement. However, it has allowed her to look more refreshed, although still looking natural and like herself. The position that the brows are ultimately placed with a brow lift should be discussed in detail with your surgeon. There is room in this procedure for creativity, and the artistic taste and opinion of the surgeon is very important, and even more important that you understand his goals and preferences. Although this patient continues to have some fullness in the upper eyelids, I personally prefer this in her case, as it allows the result to look more natural. Again, a more conservative lift usually keeps the eyes from looking hollow and the patient surprised. This is an isolated photo of a patient 9 months following an endoscopic brow lift, lower eyelid surgery, and a facelift. She has achieved a more rested and less intense look with this procedure. Because the muscles were thin between her eyes, the vertical creases are much improved. However, the purpose of the photo is to show that the small horizontal creases and texture changes of the skin for the most part will persist unless an additive procedure addressing the skin is performed. These are before and 5-week as well as 1 year after photos of a 39-year-old patient who had an endoscopic brow lift, upper and lower blepharoplasty performed. This gives you an idea of what you may look like at these times. Although his brow has settled some a year post-op, he benefited from the procedure. He looks less tired, but continues to look natural and masculine. It is typically even more important in men to be conservative with the surgery to prevent them from looking feminine or surgical. These isolated photos of the brow area were taken 15 months after her brow lift, upper and lower eyelid surgery, and facelift. Her incision was at the hairline, and she is wearing makeup in both photos. She had more aggressive contouring and thinning of the muscles of the brow, which allowed greater improvement of the wrinkles in her brow. However, wrinkles are permanent changes in the skin, which can usually be improved but not eliminated. These procedures have provided a more appealing forehead, brow position, and upper eyelid. This is an example of a brow lift in a younger patient. She is 32 years old. The isolated photos reveal that she has undergone an endoscopic brow lift, upper and lower blepharoplasty, and rhinoplasty. Again, makeup adds to the improvement you see in the after pictures, which were taken 16 months after the procedure. Her needs for the procedure were not as dire, so the results are not as dramatic either. Nonetheless, she has benefited from this procedure in improving the position of her brows. The vertical scars at the hairline at this time were not noticeable at all.
As people age, we see some of the characteristic signs of aging in the brow area. As the brow skin descends, extra skin or hooding of the upper eyes becomes apparent. This makes the eyes appear small and tired. Many years of animation produces permanent skin changes in the form of wrinkles. These occur mainly as horizontal wrinkling from repetitive raising of the brow, as well as vertical and horizontal wrinkles at the root of the nose from constant squinting. A brow lift is indicated or useful for a patient to improve these problems, among others. So, brow lifts not only lift the brow and decrease the hooding of the upper eye, but the wrinkles can be modified as well to soften them. Specific underlying muscles can be thinned and weakened to decrease unwanted select movements such as squinting. A brow lift can also be used to move the hairline forward or backward. If performed along with a facelift, a brow lift can enhance the overall result. When done together, raising the brow tissue is beneficial in unloading or allowing natural redraping of the extra skin pulled into the temples from the facelift.
The goal of this procedure is to raise the brow to a natural level, which is not so high that one looks surprised. Desired muscle activity should be maintained to provide for natural animation, while undesired activity can be diminished. Wrinkles in the brow can be softened, but the permanent damage cannot be completely corrected. The scars should be minimized or hidden, and the hairline should not be displaced in an unnatural or unwanted location.